Hi, my name is Ben Meijer. I'm a therapist and I'm an experienced expert in the field of derealization and depersonalization. In this video, I'd like to explain a little bit more about the possible causes of DPDR. Now, although there are numerous causes, I'm going to group them together in a number of categories. In my practice, I treat a lot of people who got DPDR after having used recreational drugs. That's about 70% of all my clients, recreational drugs. These recreational drugs are mostly weed, ecstasy, and some hallucinogens like LSD and some mushrooms. The second category is what I call traumas. They are usually extreme traumas and very sudden traumas, like losing one or two loved ones in a very short period of time and not being able to deal with it. And the third category is what I call the women trying to be perfect, and usually during the latter part of high school and college. So in the third category, we have the stress, which can actually cause DPDR. Now, in that category, we have a lot of people who push themselves and try to achieve things by pushing themselves and disregarding their body and their feelings. So they push themselves past what's normal and past what you normal people would say, it's time to go to sleep, it's time to relax. They keep going and pushing and pushing. Now, like I said, there are a number of other categories and a number of other causes. For instance, I once got a person who had a gun put to his head, and from that moment on, instantly, he was in DPDR. Other people, for instance, have had a DPDR when they stopped using their antidepressants cold turkey from one day to another. Poof! DPDR came and they thought it would go away, but it didn't go away. So yes, you can get DPDR, for instance, from a single panic attack or from having depression, but most of my clients are in the first three categories, meaning recreational drugs, traumas, and the third is extreme stress, and that usually tends to be women, but it can be just men as well. These are the three categories of causes of DPDR. Do you want my assistance in curing your DPDR? Call now.